Hello again, everyone. My name is Marty Guthmiller, and I am CEO of Orange City Area Health System on December 17, 2020, bringing you the 81st edition of our COVID-19 community briefings. Since this is the second briefing of the week, we will just jump right into the Sioux County statistics. And again, I'll be giving you some statistics that are a bit more narrowly defined than what we've been used to doing, but I think more relevant at this point. So let's start with the Sioux County 14-day average. Things are improving. It's at 17.3%. That is down from 19.1, which was down from 19.3, which was down from 20.0. So the 14-day average in Sioux County is heading in the right direction at 17.3. The 7-day average, which is a more recent statistic, and again, a real snapshot and indication of where things are going, is 13.7. So again, heading in the right direction, down from 15.5 and 13.2 before that. So the 7-day average, 13.7. The other metric we've been following is the positivity per 100,000 of population. Again, that sets the mark equal to all other counties, and we can measure ourselves against state averages with that. Sioux County is 386.7 per 100,000 population. That is down from 401, so that is an improvement as well. The 386.7 is down 8.75% from the previous 7 days. So again, that is a positive move as well. This thing isn't over, and we're going to talk about that in several different venues here coming up. But one of those indications is that we've had 72 positives this past week, or since Monday, in Sioux County, for a total of 4,139. So again, 72 positives since Monday. Stepping up to Region 3, the 20 counties in Northwest Iowa, good news again. The number of hospitalizations in those 20 county region is 128. That is down from 138, which is down from 150, which is down from 174 in our previous reports. 20 people are currently in our ICU in Region 3. That is down from 22. However, we have 13 people on ventilators of that 20. That is up from 11, another indication that this thing isn't over. At the state level, the individual positivity over the last 14 days is 13.7%. So you can compare that to Sioux County at 17.3. So at the state level, 13.7, that is down from 15.1, which is down from 15.7. At the state level, the individual positivity in the last 7 days was 10.5%. That was down from 11.1, which was down from 11.7. So again, the appearances are things are heading in the right direction. The individual positivity per 100,000 population at the state level for the state of Iowa is 310.2. So you can contrast that versus Sioux County of 386.7. The 310.2 at the state level is down from the previous report of 323.0, which is down from the previous report to that of 377.8. So we've had some nice movement at the state level in terms of the positivity per 100,000 population. The number of hospitalizations of Iowans hospitalized somewhere is also going down. That number today, the most updated number that I have is 776 Iowans hospitalized somewhere. That number is down from 863. Closer to home in Sioux County, we have 9 people hospitalized. Previously, we've had 7. Another reminder that this thing isn't over is that our death tolls. We had 238 deaths since Monday in the state of Iowa. Our total now is 3,451. Sioux County has 40 official deaths from COVID. The demographic has changed only slightly in that it is now 93% of the deaths are in the age group of 60 and over. That increase from 92 to 93 is largely because of the 80 plus group, and that 80 plus group is now 58% of the deaths in the state. I want to shift gears now from the statistics a little bit to a vaccination slash vaccine update. The situation is very, very fluid, and you can imagine the complexity of distributing millions of these doses. Well, we really don't care right now about the millions, right? We care about the hundreds, and we care about what we're going to get right now. That's of most importance to us at this point. Two key things to and we'll go back to maybe the baseline that I've talked about before, and then two key changes to that. So I talked previously about the two different methodologies. First, our senior care population and staff will be taken care of by the Walgreens / Pfizer model, and that will be taken care of 100% by Walgreens, is expected to begin on or about December 27. We don't have any updates on that, but that is our senior care plan. It is the plan that is being mandated by the state, and we certainly are adhering to that. The second part of the overall model is the general population model. And in our case, I've been reporting to you that we're going to receive 320 doses, and that would be of the Moderna variety. We believe that that's still the case. However, the 320 has now been reduced. We received notice last evening that as much as 30% of that allocation is now being reduced. So instead of 320 doses, we're probably expecting around 200 at this point. Now, we still haven't seen those, but the 320 has now been, we're down to expecting just a little over 200 now. So that's not good news. However, you have to also apply that now with another order that's been issued through the Iowa Department of Public Health, and it's called the Vaccine Shortage Order, and it's in place effective December 14. I'm going to read a little bit from it because it's very descriptive, is one word to put it, in terms of how we can apply these vaccines. First of all, and I'll read from this, number one, you shall only administer COVID-19 vaccine to individuals included in priority designation phase 1A, including, and it goes on to describe phase 1A. It's healthcare personnel who have the potential for direct or indirect exposure to patients or infectious materials. It also, phase 1A also includes long-term care facilities, and further definitions of those are being provided, but certainly nursing homes are part of that. But that is being taken care of through the Walgreens Pfizer model, as I talked about earlier. So the focus that we have right now is really on the Moderna distribution, the expected now 200 plus doses of that, and who is in line. Our hope was that we were going to be able to distribute those extra doses to Landsmere Ridge Independent Living, to the Pioneer Home, to perhaps even those 70 plus in the community. It was just going to depend on how many extra doses we had. Now that is not an option for us. There's a mandate, and again, reading from this, you shall only vaccinate persons who are included in priority designation 1A. In case that wasn't clear enough, you are prohibited from vaccinating any person who is not included in priority designation phase 1A. And in case you didn't get that yet, it said, pursuant to Iowa Code Section 139A.25, an individual who violates this order may be subject to criminal prosecution. So we will obviously be following the order through IDPH, and will be only allowed to reserve doses and actually vaccinate those people in category phase 1A. So let's just say hypothetically that we have, let's just say 75 people, and we get 200 doses, and we have 75 1A classified people that want the vaccine. We have 125 doses left. What happens to those 125 doses? According to our understanding of what currently is in place, those extra doses go back to the state to be distributed to someone else in the category phase 1A that hasn't received a vaccine. Then after that, it'll come back for the next tier of designation. It's disappointing, but we understand that, and we'll certainly be following that as per law at this point. So I wanted to explain that to you. Hopefully that's, as we say, sometimes clear as mud. We hope you understand that. We will keep you as informed as we possibly can, as soon as we can. We ask that you please do not call our clinic or our hospital asking how to get the vaccine. Our staff, in all likelihood, is not going to know how to answer that question because we haven't been told. We don't know yet. As soon as we do, we will come back in this format, other public service announcements kind of thing. I pledge to you that we will communicate as soon as possible how we're able to distribute this vaccine. My guess is it's going to be a few weeks before the general population is going to be able to get that. Because if you think about it, it'll take a week or so for us to get the vaccine probably. It'll take a week or so for us to distribute and vaccinate those people. It might take a week or so to get it back to the state, for them to distribute to another phase 1A class. And then it might take another week or so to get the next tier back. So this is going to take a while. And so we just ask for your patience and your trust in what is an extremely fluid situation. And again, we pledge to you that we will keep you as informed as we possibly can. That's where we're at today. The good news is that the numbers are heading in the right direction. The bad news is the vaccine might be slowed down a little bit. But again, we need to be thinking in terms of a number of a few months, instead of in terms of a few weeks. So again, appreciate your trust and confidence and patience in us. Again, this thing isn't over. People are still dying. People are still suffering. We ask for your continued strength through it all, for your example, for your vigilance, for your continuance of the social distancing measures, the masking, the hygiene, all those kinds of things. We ask for that. And we pray through it all that you all will remain as healthy as possible through all this. We wish you all a very Merry Christmas. Certainly, as your family plans and things come together, please be a little bit careful. Please be discreet. And just, again, stay vigilant. Thank you again for joining us. I do anticipate a briefing on Monday, which is, in this COVID world, 3 or 4 days is a long, long time. So a lot can happen. I anticipate that I'll have some new updates for you on Monday. And so until then, stay strong, stay vigilant, and stay safe. Thanks.